Hello, everyone. We are here with day 3.3, and we are wrapping up Identify Dermatological Pathologies by Images and Presentation. All right, so we are going to talk about skin cancers, skin pigmentation disorders, and various conditions. All right, so skin injuries will include bruises. Most of these images are of subcutaneous bruises. Bruises are also called contusions and are injuries from broken capillaries. Some of your instructors or people you may work with may say capillaries, capillaries, potato, potato. It's leaked blood collected in interstitial spaces that creates skin discoloration. Right, there are several types. Those located right below the skin surface are called subcutaneous bruises. Those inside of a muscle belly are called intramuscular bruises. And those on bone, which are incredibly painful, are called periosteal or bone bruises. Now remember, periosteal bruising, that's on your periosteum. That's on that hard enamel layer on the outside of your bone. And it is the only portion of your bone that has nerve endings and can feel pain. All right, massaging and bruises. I kind of disagree with the book in two places here. Subcutaneous bruises are local contraindications until they begin to turn greenish yellow in color. That is a definite further along phase in the healing process. Some bruising is different than others. I like to recommend an ice massage to create vasoconstriction, starting at either the distal end of the bruise and lightly moving proximal over the bruise with the ice in like upward vertical movements to help promote flow going upwards. It's entirely up to you and how much training you have. I will leave it there. Perhaps you don't want to touch them at all for a variety of reasons. Light pressure massage can be applied over bruises caused by aging and blood disorders, according to your book. I'm hoping they mean something like sickle cell anemia, because if someone is a hemophiliac, or they have a blood disorder where they bleed and bleed, a bruise to them could be a life-threatening condition. All right. Please make sure they don't have hemophilia or another bleeding disorder, which isn't necessarily a blood disorder, but it's a loss of blood disorder. So if your client says they have a bleeding disorder and you see a bruise, you need to let them know immediately, because they could need potential healthcare ASAP. Scars are a scab caused by a burn. All right, this is a mark left on the skin after the body repairs major wounds caused by surgery, injuries, or diseases. And they can be pretty intense, huge, or they could be very tiny, thin little slivers on the skin. Scars can extend deeper and deeper into the layers of the skin, causing adhesions. All right, adhesions are bands of scar tissue that bind together two or more tissue layers that aren't normally bound. All right, it's going to stick them together, it's going to adhere them like glue. All right, so instead of moving freely and sliding these two tissue surfaces, they're going to start to do this because they're adhered to each other. They may appear as thin sheets similar to plastic wrap or as thick fibrotic sheets. I have some pretty cool videos about fascia. That's a pretty good idea of what an adhesion would look like. Adhesions can impair mobility and are more common in surgical scars. All right, scars are the result of collagen production, which occurs during the healing process. There is different stages of wound healing. Your book has these three: inflammation, proliferation, and remodeling. Proliferation also is regeneration, remodeling is also maturation. But I'm going to talk about this next slide because every time I have done MBLEX sessions with folks after they have taken the MBLEX or helping people study for it, going off of the newest research with the MBLEX, there are usually 4 or 5 stages listed not 3. So we're going to use this 4-stage model of wound healing. And that first stage is hemostasis, where blood rushes to the site of the wound and clotting occurs. Stage 2 is inflammation, where cells are sent to repair the wound. All right. The wound heats up because all the stuff is flooding to it. The pain increases because it's swelling and it's irritating all the nerves in the area, and redness spreads. This can persist up to 4 days. Stage 3 is proliferation. The tissue around the wound contracts, drawing the wound smaller and smaller and closing up the skin. This usually occurs from day 4 to day 21. And stage 4 is remodeling. So after around 21 days, the deeper structures begin to form, giving the wound tensile strength. This process can continue for up to 2 years. All right. It's during that time, during that stage, that's your chance to break up adhesions and really be a valuable help, stretching and forming that scar to be able to move along with the fascia and the tissues of the body. If you don't move that scar around in this remodeling phase, it could just continue to contracture. All right, hypertrophic scars. These scars are elevated scars, but they do not spread beyond the boundaries of the original wound. All right, so someone has a slice on their arm, like the one pictured here, like a knife slice. The scar is just going to be over that line in a nice, neat vertical or horizontal line. And if you're rubbing your finger along it, it would be nice and smooth, nice and smooth. And then there would be a hill of either striated or completely glossy glass-like smooth skin, and then it would continue back down after your finger dropped back down on normal skin texture. There are keloid scars. These are elevated scars, but they spread beyond the boundaries of the original wound. There is an image here of this gentleman who has a pretty impressive keloid scar on his earlobe, and it has been excised. All right, you see how nice and tight that is after they've removed the keloid scar. Here's the problem not mentioned in your book. Keloid scars have a tendency to regrow, and very often treating the keloid scar can cause it to metastasize even faster and grow bigger than it did originally. So you are creating a never-ending issue. Contracture scars. This is when the remodeling phase goes wrong, as well as perhaps there just wasn't enough tissue to go around to heal everything up, or the body was in a tightened position as it healed without enough stretching to allow full and proper growth. Um, Here is some images of common contractures that you would see like in burn scars. This young child cannot fully lift and turn his neck. It looks like that burn went all the way through the platysma muscle. In this case is what it looks like, maybe a 4th-degree burn on the neck through the muscle and a lot of 3rd-degree burn on the face. All right. This scar over here on the right seems to be some type of cut, a laceration rather than a burn, but you can see how there wasn't enough skin to go around, and as it healed quickly, increasing the tensile strength and binding all of this up, but not allowing for a lot of movement. And now we have a contracture and what it looks like to be someone's waist. All right. A scar massage is thought to work by accelerating collagen maturation, influencing scar remodeling by disrupting fibrotic tissue, improving pliability, and reorienting collagen fibers. What do those words mean? You're going to disrupt the fibrosis, you're going to disrupt the adhesions, you're going to improve pliability. That means it's stretchy and flexible and moves now. Reorienting collagen fibers, all right? We are taking collagen fibers that were just going everywhere in a mix match, and now we are going to try to align them vertically or horizontally, whichever way that that muscle movement most typically goes, maybe even in a diagonal direction. The scar over the wound or incision is a local contraindication until the area is dry. It's no longer a moist wound, and in the remodeling or maturation phase. This time frame is usually a minimum of 8 weeks, sometimes longer, depending on the thickness or the complications involved in this scar. These are different movements for scar tissue massage. You could do circular, also known as like cross fiber friction. You can do vertical, you can do horizontal. If you guys are interested in seeing examples of scar massage, I would be more than happy to record some of those. So if you're interested in some of this modality stuff, just shoot me a message. Unfortunately, we are not on ground together, but I can absolutely at least record a video showing you how to do some of these techniques. All right, I have some research here for you if you are one of those students that likes to download the PDF to read. Burns are tissue damage from heat, radiation, including overexposure to the sun, chemicals, or electrical contact. It can go from superficial to deep, which are how we classify them. We classify them in 4 different levels: first degree, second degree, third degree, fourth degree. Basically, a first degree burn is, ooh, I touched a hot pot or a hot pan, and now the very tip of my finger, just that outer layer, that epidermis is burned. And it's not very friendly. It definitely touched my dermis a little bit, and it excited my nerve cells. A second degree burn is a partial thickness burn, and that goes deeper. It involves both the epidermis and upper layers of the dermis. And now hair follicles and sweat glands are damaged in this a little bit. They remain functional, they heal. You might have a tiny little bit of scar, but they're just touched. The nerve is touched. It lives in the dermis too. The hair is touched, the glands are touched. They survive though because they are just introduced to the pain. The third degree burn is a full thickness burn. This destroys the epidermis, the top layer of skin. It destroys the dermis, the second layer of skin, and it destroys the hair follicles in the dermis, glands in the dermis, and could go down to the subcutaneous or hypodermis layer, and any underlying soft tissue, like some extra adipose layers. Fourth degree burn is a full thickness burn that extends all the way through, all of it, including any hypodermis thickness you have, all the way down to the muscle, potentially all the way through the muscle to the bone. Right? Burned areas are local contraindications until the area has completely healed. You can treat these like scar tissue. It is scar tissue basically that you'll be working on. Things like cocoa butter, shea butter are highly recommended to work into these areas. All right, here's some more research. There's been some pretty cool clinical studies done with burns and scars and massage therapy. All right, stretch marks. I strangely love working on stretch marks. I don't know. It's one of my things that I enjoy doing. They're indented lines or bands from overstretched skin. They're most commonly located on the breasts, hips, thighs, buttocks, and abdomen. And these are called striae. This is a pretty cool image out of your book where they had two ladies with very similar stretch marks here while they are pregnant. It's pretty cool. Stretch marks are caused by rapid expansion of connective tissue, leading to skin thinning and atrophy. But this can also occur from rapid weight loss, not just weight gain. So please be aware of that. Um, your skin would become thin when you gain a lot of weight, and it could possibly atrophy as you lose weight too quickly, and your skin is unable to snap back into place. All right. Stretch marks begin as painless indented red, pink, purple, blue, or black lines or bands, which eventually fade to silvery white sometimes. And sometimes they appear really glossy or shiny or even metallic. Um, They sometimes are depressed into the skin, and they definitely have a different texture from normal skin. I'm going to show you another image here in just a second, but the best way I can describe the texture on a very deep stretch mark is if you were to touch a damp cobweb, not a spider web, but the cobweb that almost looks like a silkworm nest, where it's just layers and layers and layers of fine threads of silk all together. And if they're all going the same direction and then you rub your finger across it, that is what the inside of a large indented stretch mark feels like to me, at any rate. Use light pressure over stretch marks because they are weaknesses in the skin. All right. Here we have some images of stretch marks. Of course, you can see them up here in the armpit. This appears to be across someone's back. This is a pretty impressive amount. It almost looks like lightning strike scars at first, but these are stretch marks over the hips, the sides, etc. You can see some of this apron down here, this abdominal apron of adipose tissue that is hanging, the skin is hanging. This is caused by very quick weight loss, where obviously there at one point was a lot of adipose tissue, and now you see how all of these stretch marks are tight and wrinkled together, whereas where we still have some girth here, they are stretched out and firm and not folding in on each other where they become indented. This image here is one of the fitness creators I actually watch sometimes on TikTok, but I came across this image from another scientific site of all places, so I snagged it because her stretch marks are some of the most interesting that I've seen. You can see here how deep and how wide they are, where there are bands of healthy tissue, and then there are sections that are as wide and as deep as your thumb pad that you could literally run down inside of that. Now, when you have scar tissue like this inside of the stretch marks, or stretch marks that are so deep like this, there can actually be little funnels inside of there that are open for sebum and bacteria and stuff to get caught into, and you can actually develop a lot of blackheads or whiteheads inside of stretch marks like this, which will cause them to become irritated and a lot more tender than what they would be normally. So please watch out for that. Corns and calluses. Uh, if you watch my other lecture over the entire chapter, I have a video from a podiatrist who when that song became popular with the little kid singing, corn's the big lump of knobs. Yes, there's a delightful corn song for you, and I wish I had it in here. However, onward and forward, corns and calluses are thick, hardened layers of skin that develop over areas subjected to repeated friction and pressure, usually on the hands and feet. Calluses are usually less painful, and they are in areas that have a repeated pressure, whereas corns, you really need to ask a client about sensitivity to massaging because they're sometimes on non-weight bearing areas like in between the toes or on top of toes, and they can be quite painful. So definitely check with your client. You can massage both of these. Calluses you can do quite a bit deeper and harder. They're already taking a beating, and that's why they have formed. But you can use some emollient lotion to help soften that skin up in case they want to shave that thing later when they leave your office. Um, but you absolutely can massage both of these. Decubitus ulcers, plural, is known as decubiti, can happen quite quickly, and they are injuries to the skin and underlying tissues from prolonged pressure and are usually found over bony prominences. All right, so like if you're sitting in a wheelchair on your ischial tuberosities, or you have force on the back of your thighs or in the backs of your knees, the popliteal areas, and your legs are constantly resting down, so the plantar surfaces of your feet are getting that pressure, you are more prone to decubitus ulcers in those areas. They're also called bed sores, and pressure ulcers. They are also classified in stages 1 through 4, just like a burn. All right. They are a local contraindication. Watch out for something called non-blanching skin. That's when you have a red rash like the one pictured here, and you press down on it, excuse me, it will not lighten, it will not blanch, it will not turn white or lighten in color. Now, this is for people with lighter skin tones. It's harder to see blanching the darker and darker a skin tone gets. All right, so just be aware of that. If you see any patches or areas like this, just assume it's infected right away. Anyway, even if this is not the beginning of a decubitus ulcer, and this one clearly is, it's stage 1 everywhere, but right at the top of the gluteal cleft, it looks like it potentially could be forming into a stage 2 there with the skin about to break open. Please be aware of these. If you smell something foul in there, it could be an infection. So make sure that your client sees a healthcare practitioner right away. Skin cancers are abnormal growths of basal cells, squamous cells, and melanocytes in the skin. All right. They did a study between 1994 and 2014. All right. In that 20 years, the diagnosis of non-melanoma skin cancers in the United States increased 77%. Um, Considering that some of these are due to exposure to things like pesticides, I'd be really curious to see what the study would be if they did it from 2014 to 2024. Mm. Anyway, the American Cancer Society advocates that you use the ABCDE rule to look for signs of changes indicating melanomas. All right. You're looking at your client's back and back of their legs and arms and their neck more than they ever will. So look for asymmetry, A, B, border, C, color, D, diameter, E, if it's evolving. How big is it? What color is it? Is it 2 different colors? Is the border irregular? If it's asymmetrical, it's like different shapes everywhere. Definitely advocate for them to go see a dermatologist or their PCP. All right, this is a little blurb to remind you to protect your skin and eyes against excessive sun exposure. Yes, but also keep in mind that's where you get vitamin D, and we don't want to get seasonal affective disorder because we have a vitamin D deficiency. If you have a vitamin D deficiency, you might also want to take zinc. I'm not giving you that advice because that is out of my scope of practice, but you might want to do some research on protecting your skin and your eyes while we are talking about skin disorders, and the overexposure from the sun can cause a skin injury. Please remember, while they do recommend wearing a sunscreen, and you can get sunscreens up to 100 SPF, sunscreens, like massage lotions, are not actually investigated or cared about by the FDA whatsoever. So you may get contact dermatitis, boom, that we talked about in the other lecture, because your ingredients that you're putting on your skin are not regulated and sometimes quite dangerous. All right, moving on. Just make sure you use critical thinking and do your research. Basal cell carcinoma is a skin cancer arising in the basal cells within the epidermis. Basal cells produce new skin cells as old ones die off. And basal cell carcinoma is the most common form of skin cancer and accounts for almost 80% of cases. The good news is it is the least deadly because it grows so slowly. Unfortunately, this is the one as you remove it, it can keep coming back. If you are exposed to HPV infection, arsenic found in drinking waters, in wells where arsenic-laden insecticides were used, please be aware that you might be more prone to having this. All right, signs and symptoms are lesions that have raised smooth borders, and then they have like a depressed center. So it's sort of like a blown up ring, almost like an octopus sucker sticking out of your skin, but it's going to feel a little bit smoother and it's small. For clients receiving treatment for basal cell carcinoma, ask about their signs and symptoms. We're going to talk about massage with chemotherapy actually in week 6 when we talk about oncology massage. Squamous cell carcinoma is a skin cancer arising in the squamous cells within the middle and outer layers of the epidermis. These cells are named for their shape and are flat like a fish scale. All right. For clients currently receiving treatment, same thing as basal cell carcinoma. You're going to need to inquire about signs and symptoms. If you see something that is a red elevated area that kind of looks like a wart, but not really a wart, maybe they're flat with a scaly center. Sometimes they get an ulcerated center, so they're almost like the basal cell raised ring, but they're scaly this time. Um, almost like a volcanic version of ringworm. You might want to warn your client that it's possible that they have squamous cell carcinoma. Melanoma is the bad boy and is a skin cancer arising from melanocytes located in the epidermis, all right, or from a mole. Melanocytes, and we covered this quite well in your other assignment for today, produce melanin, which is the pigment that gives skin its color. You can find this in lots of areas of the body. It's also in the brain as well. It's pretty cool. Melanomas are most commonly found on the trunks of men and the backs of women's legs or feet. All right. Please watch out for this. People with sun sensitive, fair, or freckling skin are at a higher risk for this. This is when you would use the ABCD to check for things like on the bottom right. We can see this asymmetrical sort of irregular border, and then the mole is lighter in the middle and darker on the two sides. So now we have A for asymmetrical, we have B for the crazy border, we have C for the weird color. All right, diameter. I don't know how big this picture is, but it's certainly large-ish looking. Certainly longer than it is wide or tall. I should say it's wider than it is tall. And I don't know if it's evolving because we don't have a before or after photo, but it certainly looks like it could be mid-growth process. This image up here is actually melanoma in the fingernail, in the nail bed underneath it. When you see patches of skin darkening that look extremely irregular like this, that is a potential sign of melanoma. Again, it's the same thing as other oncology massage. You have to make sure that you can treat them and then work with them for any other symptoms that they may be having due to treatment. If you see lesions or using the ABCDE, suspect something weird is going on with the client's mole, let them know about it. Skin pigmentation. Tattoos is a skin pigmentation that's usually elective and involves ink injected into the dermis of the skin by needles to create an image, a design, or a word. This image here, the semicolon, if you have clients coming in with that, a lot of them were suffering from suicidal ideation at some point and decided to keep on with their lives, right? The semicolon is at the end of a sentence that could have ended in a period, and then someone decided to keep writing the sentence. These are people that had a major hardship going on, like addiction, maybe a loss of a loved one, maybe wanting to harm themselves in some way, and have decided to turn the corner and change their lives and sort of start anew. So please be aware of the meaning behind that if you see that. Sex trafficking victims are very often branded with tattoos in the USA. You'll see things like these crowns, money bags, barcodes. Those are usually pretty clear signs of human trafficking. So if you ever happen to have someone come in with a tattoo like that, of course, that's not always what it means, but very often it does. Birthmarks and moles are a very interesting, dense collection of melanocytes appearing as small oval or round or brown black spots. Some birthmarks contain hair. Those are really cool. If you've seen images of those. Birthmarks are also called nevi. Moles are the most common type of birthmark, but be careful because some of them may be cancerous. So again, use that ABCDE. If a client tells you it's a birthmark, but it looks different the next month that you see them, maybe they should get it checked out. This image here where it looks all gray, like somebody has beaten this baby, it is not. This is Mongolian blue spot or blue spots. You can also get hemangiomas. That's what this image here. Now, this is a giant hemangioma, and you probably can't tell in this little video of me, but I have a tiny cherry angioma like right here, that's constantly redder than the rest of the red of my face right now. It's a tiny little spot. That's a cherry hemangioma. Angel kisses would be like a little spot on the forehead. You get stork bites is the red on the back of the neck. These are definitely varied and interesting, but except for the case of things getting in the way, like for having a giant angioma somewhere, like this one is partially blocking the tear duct in the eye of this child, or in moles that are cancerous. They are otherwise benign, interesting pigmentation features of the body. Freckles are small tan to brown spots on sunlight exposed skin, especially in children. They tend to fade as you age, all right? So they're kind of the reversal of age spots. Age spots look like freckles that you get as you get older, kind of. And then freckles you have more when you're younger, and they tend to fade when you get older. Freckles are in all shapes, sizes, pigmentations on all types of people. Melasma, tan to brown spots. They are larger and more patchy, very uneven oftentimes, and appear to be like big blurred spots rather than freckles. These appear on the nose, cheeks, and chin and forehead of women, usually caused by hormonal fluctuations, usually in pregnant women or when people are or women are taking oral contraceptives. Age spots are flat brown to black patches on the skin, and they're usually found on sunlight exposed areas like the face, hands, and arms, back, and feet. Age spots are also called solar lentigo, senile lentigo, or liver spots. So, like I said, these are larger, they're more irregular than freckles are, but they look somewhat similar in terms of coloration and location on the body. Vitiligo makes you look like a model. This is pretty cool too. These are irregular patches of depigmented skin that appear milky white. So someone has the proper amount of melanin and melanosomes in their epidermis, but some of them become completely depigmented, like in the case of albinism. All right, these patches tend to grow larger and spread over time. So I would argue that the melanin is receding rather than these patches are encroaching. It's more like the melanocytes are running away. Common areas are the face, lips, hands, arms, and legs. It is also called leukoderma, all right? Not leukemia, leukoderma. Derma, all right? So when we talk about white blood cells, all right, like leukocytes, all right, leukoderma, it is white skin. It is depigmented skin. This is called vitiligo. Albinism is a rare congenital condition characterized by partial or total lack of melanin. Individuals with albinism have strikingly pale skin, white hair, and typically pale blue or pink eyes from their visible blood vessels. Um, and that is all I have for you guys. Just to know that with massage and skin pigmentation disorders, some of these people might experience psychosocial distress. They might have a self esteem issue or self image issue if they feel that they need to hide some of these exceptionalities that make them so beautiful and different. from everyone else. So please be kind. You never know where someone is in their headspace, or where they may be coming from. When in doubt, ask twice about comfort levels, about everything. You need enthusiastic consent, and please make sure your clients are not in any pain, because you can cause damage in the skin, tearing, bleeding, bruising, all kinds of nonsense if you're going above and beyond the client's skin tolerance and pain level. And with that, I leave you until our next lecture on 3.4. Have an excellent evening.